The sun here.
Uh-oh.
All right, so my clock just turned 3, so I think we should just jump right on the road and get started here. Welcome everybody to our LUGPA webinar on marketing. We've got a great panel today. We had a meeting last week preparing for this, and it was very exciting discussion, and I'm sure it's going to carry over to today. My name is Ron Chorzewski. I'm a solutions consultant with Renate. I'm going to give everybody a chance to introduce themselves right now before we get started with our formal information. Why don't we start with the Urology Centers of Alabama, and then we'll move over to Arkansas Urology.
Great. Hey, I'm Jason Biddy. I'm the CEO for Urology Centers of Alabama. We are in Birmingham, Alabama. We've got 31 physicians and 13 locations throughout primarily central Alabama.
Great. Welcome, Marcy. Jason.
Okay. Well, I am Marcy Prescott. I'm the Director of Marketing here with Urology Centers of Alabama. Sits right across the hallway from Jason. So I hope he considers me his left or right arm every now and then. So I'm happy to be here.
Excellent. Thanks, Marcy. Scott?
Hey, Scott Davis, CEO at Arkansas Urology here, based in Little Rock, but 14 locations around the state of Arkansas, 300 employees, 30, I can't keep track, 33 or 34 providers. Glad to be here and participate in this panel.
Excellent. Thanks for being here. And Chris.
Yeah, I'm Chris Shenop. I'm not right across the hall from Scott, Marcy, but I'm right down the hall. Director of Marketing and the Arkansas Urology Foundation. Been here about 2 years. Started right before COVID. As soon as I kind of knew what was going on, COVID hit, and then everything was kind of thrown for a loop. So excited to be here and honored to be a part of this panel.
Great. Well, thank you, Chris. And Evan.
And my name's Evan Steele. I founded a company called Renate back about 7 years ago. Renate a reputation management and survey, patient satisfaction practice improvement company. And we're happy to host this webinar today.
Great. Well, thank you, Evan. All right. Well, welcome everybody. We're going to talk about marketing in some great detail. Of course, my cat just jumped up now. We're going to talk about marketing in some great detail, getting into the specifics of different strategies that some practices have taken over time. But before we get started into that, I'm curious about us just talking a little bit about the definition of marketing and maybe touching on who we're actually marketing to. I might just turn that over to Scott to start us.
Okay, thanks, Ron. Appreciate that. Well, I mean, I think as we move more and more into patient-driven healthcare or consumer-driven healthcare, I think the key things to remember are what we do as healthcare organizations is provide a service, and that service is taking care of people and making them feel better and have a higher quality of life. And so from my perspective, what marketing is getting people in the door. If it's for men, it's to get tested because men are notorious for not taking care of themselves. It's for women, it's top of mind awareness for themselves and for the men in their lives, because as we know, women make the majority of the healthcare decisions for us men. And so marketing, at least my perspective, is delivering a message that puts our brand top of mind and shares with them and provides education for the services and the surgeries that we provide to give them a better quality of life.
That's a great answer, Scott. I really appreciate that, because I think a lot of people look at marketing as from a more sales and advertising perspective, and it sounds like you're focused on access and the patient experience, and that's a great focus. Can I shift over to Jason and just ask Jason, who are you marketing to? Is it just patients?
Yeah, I think for us, it's definitely twofold and maybe even threefold. I think, we get a large number of referrals from physicians throughout the community. So we have a physician liaison that's calling on those referring physicians and constantly in their offices trying to get referrals. I think we've got a second group of patients that, you know, we are trying to educate and get direct referrals from. So getting them to directly call our office if they've got overactive bladder or BPH or you know, things like that. And then, you know, I think third is internal. And I think that's the third that, you know, I know on our call last week, we didn't discuss, but, you know, our physicians are, most of them are all subspecialized. So they do a lot of internal referrals as well for procedures. And I think that would be the third area that I would say, you know, we have for who we are marketing to.
Okay, great. Yeah, so with an emphasis on primary care type offices or people or physicians that would refer patients to you, the patients themselves, and then from an internal perspective as well. That's a great focus. Chris, I'll turn it to you. I'm curious. Do you have a marketing experience that can reflect on one of those three different focal points to market to that you could share with the group?
Yeah, that's a good question. And I'd really say here at Arkansas Urology, we have kind of been able to do a combination of those three things. Recently, this is our 25th year. And so we're really raising awareness for our history as well as kind of what we hope to build on in the future for years and years to come, but just through highlighting our people, our physicians, our longtime employees, recognizing monumental anniversaries as far as how long they've been here, using that opportunity to really partner with our vendors and our drug reps, and just also tell the stories of our patients and how Arkansas Urology has impacted their lives and their families' lives over the years. So I think it's really been a good excuse for us to kind of all row in the boat together and kind of tell a constant message about who we've been for the last 25 years.
Excellent. So when you talk about partnering with drug reps, can you give me an example of that?
Yeah, you know, from a foundation standpoint, that can be anything from Kickoff to Men's Health, which is our big prostate cancer screening events every September that we've done in Little Rock and North Little Rock, 17th annual for both of those. But last year we expanded to some more locations across the state. And so that includes Bentonville, El Dorado, and Pine Bluff. So whether they're coming in volunteering, whether they're here giving out educational material, whether they help underwrite the cost and their sponsors, that's from a foundation standpoint. From a marketing standpoint, we've really utilized webinars and community health talks for them to kind of reach out to patients and allow this anonymous, you know, screen to really, I think, be beneficial when it comes to doing a webinar with the doctor and patients being able to ask questions and not being front and center and having to raise their hand and talking to a microphone and just kind of be embarrassed, or, you know, when it might be a question that they don't feel comfortable asking in public.
That's great. So a big focus on educating prospective patients or even patients. So Marcy, I'll ask you a similar question in terms of educating providers or referring providers. What kind of things have you done to educate physicians who may be referring patients to your practice?
Well, every year, I've been here 5 years. We didn't do one this year, but we do a CME event. So your medical education event, and we target, obviously we invite all the urologists in the state to attend, but we target our primary care providers, the nurse practitioners, the PAs in the area. And we have really big success with this through our physician liaison, because she's there talking to them about, you know, here's an opportunity to get your continuing education credits. It's an opportunity for those primary care providers to have face-to-face time with our urologist. So it's a good opportunity for them to communicate and talk about, you know, anything new or what are they seeing in their offices. And, you know, and it's a good opportunity for us kind of going with, you know, reps, farm reps and things like that. They come in and we have it's almost like a trade show. So they come in with their booths and things like that. So it's very, it's a big open forum, you know, and it gives us the opportunity to, you know, show us who we are to them, and then vice versa.
Okay, great. Now, how hard is it to get the CME credits for a conference like that?
Well, no, we go through the Medical Association of the State of Alabama. So there is an application process that we have to go through where we, everybody laughs. I mean, I start working on this probably right after the last one ends because they're sticklers here, but we work with a third party that helps me with that. That helps me get the applications. Most of the speakers are our physicians. This year, actually in 2022, we're going to branch out a little bit and have some different speakers to come in just because we feel like we've talked a lot about, like I said, over the past 4 or 5 years, a lot of UTIs and antibiotics and what we should do. And we always have big discussions around low T, PSA screenings. We always like to, keep up, with what people read and what our recommendations are. And so, but to kind of get all that together, it's not too bad, the application process. And then we get the permissions, and then we are able to promote the conference with our vendors so I can start to go and get sponsorship money. So, and I mean, we've had it to where, it's paid for itself year after year, and everybody really likes it.
Excellent. Now, do you have to charge the people that are in attendance, or is it viewed as an inducement if you're not charging them, or do you charge them?
I don't know that answer. I mean, there is a registration fee because there are, obviously there's, we do it at a conference center. There's food, there's beverage. We actually have a reception the night before. So, we always do, like, I'll tell you, we always do early bird specials. Like if it helps us with a head count of everything. Mm-hmm. But we do it by the book. So there should be no inducements or anything like that. But we do charge the participants a fee to come, and they get, I think, anywhere between 4 and 6 hours for the day.
Okay, great.
And then sometimes, and I'm just going to throw this out there, sometimes we actually, at the end of our hours, we'll bring in somebody maybe to speak of opiate credits, because our physicians in the state of Alabama have to have so many opiate credit hours every other year or something like that. So we kind of throw that on the back end, and that's a really big selling point.
Nice. Well, I certainly didn't mean to imply that you weren't doing it by the book. It was more just a question, because I think some people might have that question about if you have to charge or anything like that. So I'll throw this out to the whole panel, and I'm interested in hearing multiple responses, because I think there's different strategies to take with the different aspects in urology. So I guess I'm curious, the different service lines. So there's like, BPH screenings and things like that, or there's vasectomy type clinics. I guess I throw it out for some success stories of marketing some of this kind of the special aspects of the specialty.
Yeah. Yeah. Marcy, ladies first. Go ahead. No, go ahead.
No, go ahead.
No, ladies first.
Well, I was going to say, obviously, we're in September. That's Prostate Cancer Awareness Month. It is a great opportunity for any practice to reach out to their local news media. They're always looking for a story. I mean, I think we had 2 physicians on 3 or 4 shows so far, great coverage that way. And we even had a webinar last night on ED and incontinence for prostate cancer patients. And so I think, I'll just start. I think we do a lot of the same things between Arkansas and Alabama. I think we're about the same size, and they offer cancer centers and things like that. But just say right now, off the top of mind, September being Prostate Cancer Awareness Month, we're doing a PSA screening at the soccer team's game this Sunday, working with one of the local foundations here. So I would say definitely you should take advantage of like September, and then obviously again in November for November. And I think that might be a good segue. I know Chris had mentioned they did some things around November that was really creative.
Yeah, and in fact, it was the first time that I had really grown a beard since college. So it was a good excuse not to shave for a couple of weeks. But Scott, do you want to talk on maybe some of the specific campaigns that we have?
Yeah, I think especially related to men's health, and we do a lot, and we run this through our foundation, is just free screenings. And we do that throughout the year. And I think, Chris, you had done a little bit of research for this call, just looking at, I'm a former CFO, so marketing is I came here over 8 years ago. Marketing for this group was telephone book advertising. And we've come a long way since then, where I kid you not, and for the people on the panel that know what I'm talking about, as well as in the audience, I mean, I walked in here in 2013 and we were spending $60,000 to $70,000 on yellow page advertising and white page advertising in local phone books. I think our spend right now in just phone books is less than $2,000 a year for some of our rural markets. So we do a lot of digital, a lot of SEO, SEM, direct to patient, direct to consumer. But we offer what's called a 10-point checkup for men, which is 7 labs and 3 questionnaires ran through our foundation. And being a former CFO, I want to understand what's the impact of that spend. And so we tied the cost of the marketing to what we were seeing in new patient encounters, established visits going up, and then actually downstream revenue as a result of that. And Chris, I know you kind of looked at some of those numbers, and we worked with we have an external marketing team as well that we work with that was tracking spend versus return. And Chris, you want to share some of the numbers around that?
Yeah, well, and for instance, I mean, based on those number of free screenings, when kind of we first started doing these dashboard campaigns, we were having about 20 men come in a month. Last month, we had over 140 come in. That also has a lot to do with follow-up visits and then downstream revenue from patient visits, which has gone up almost 25% over the last year, just since we're tracking it and really making sure that we follow up with those patients in a pretty strict manner through our navigation processes and have our men's health team kind of stay on top of that, stay in touch with them. But it really, I think, kind of allows us to be that much more comprehensive when it comes to men's health and men's health issues and having our patients just kind of be along for a long-term relationship and not just pop in the door for one free screen.
Yeah, so the end result, guys, is that we use the foundation, we use the marketing dollars to get them in the door. It still gets back to, if we can get men in the door, or women for that matter that have OAB or other conditions in the door. We do 7 labs. We do a SHIM and IPSSS, and then we do a sleep questionnaire. We're going to identify abnormality with a lot of the men that come through those screenings, and then they flow directly into a new patient encounter and then into our clinical pathways, whether it's BPH or in some cases elevated PSA, and they move into our prostate cancer pathway. So it's a great resource for education, but then getting them in the door so that we can take care of their conditions.
Excellent. I love the access emphasis. So, Jason, I'm curious about how have you addressed access in your practice, and what techniques do you think other practices could employ to solve an access issue?
So, probably the biggest thing we have done is the addition of APPs in our clinics. So each of our main locations now, we've got either a physician assistant or a nurse practitioner there every day. And so when, patients call and they need to be seen same day, we are getting them back to the location they're normally at with a PA or nurse practitioner and kind of taking care of their needs. And I think we're also trying to educate patients that, if they have something urgent, avoid urgent care, avoid ER, give us a call and we're going to get you seen timely. So I think, that has been, again, something big that we've been able to do. We've been able to promote it and market it, because I think most of the time people think, well, a specialist, it's going to be 3 or 4 weeks out before we can even get in to see them. And, I think, just through, creative staffing and schedules, we try to keep the doctor's schedules open for new patients and for cancer consults and kidney stones and things like that. And we use our APPs a lot for those follow-up and more urgent type visits. Mm-hmm.
Yeah, and I think you shocked me last week when we spoke. I think some of your physicians actually give out their cell phones to the some PCPs. Is that right?
Yeah, that's one of the things I'd mentioned, marketing to our primary care doctors. So our physician liaison, she actually made the suggestion. She said, hey, what about putting our physicians' cell phone numbers on the back of our flyer that has all their pictures on it, just to be given out to our referring doctors? And we spoke with our physicians, and, surprisingly, they said, yes, absolutely. We want referring doctors to be able to get in touch with us directly if they've got a question. And, I think there's always concern, would that be abused? But in our case, it hasn't. And, doctors, again, just in terms of having easy access to our physicians, I think that really made an impact with those referring doctors being able to get that information.
Yeah, that's an impressive accomplishment with such a big practice. So Marcy, you had mentioned, I think earlier, I think you both have physician liaisons that visit PCP offices. I guess I'm wondering, how big of a practice do you need to be before you have to have somebody like that, or it's good to have somebody like that? And can a small practice still benefit from that type of an approach, even if they don't have a physician liaison?
I'll speak to that briefly. Okay. Prior to urology, I was with an allergy practice, and it was much smaller. We had a part-time physician liaison, and she did the same thing. So I think big or small, I think that's an important role if you're a specialist relying on referrals from primary care doctors. And I think, you've got reports that can track that. I know I saw, I think Cash Shadig on the call from InfoDive. InfoDive has a great report on top referring providers. We get that report every month. That goes to our physician liaison. She's able to compare different periods and see if there's variations in referrals, and can quickly get into those offices. And sometimes you identify there's a problem, hey, we've not been getting notes back from a doctor, or, we've had trouble getting patients scheduled. So, the sooner you can identify those and put in corrective measures to get those referrals back, the better. So, every week our physician liaison sends a report out, and, there'll be things in red that say action items that, she's found while she's out in the field. So, I think it's a, again, very valuable position. I think we get a lot of great feedback. And I think regardless of your size, you better have somebody, touching base with your referring providers to make sure that they're getting the service they expect.
And also, I think you mentioned monitoring the referrals from specific practices, that some of the PM systems allow for you to do that kind of internally on your own. And it sounds like there's some other companies that can help you do that as well. I think an important point that somebody had made on our prep call was, I think it may have been Chris, was about having a call center and then tracking the zip codes where patients came from. Is that from Chris, or is that with Marcy? Or both?
I know we do it we do it through the InfoDive report.
Okay.
But I think Chris actually was the one that had a system in his call center.
Yeah, so we do that in our call center. Just we kind of have a general number that patients call from all over the state, and we track them through that kind of methodology.
That's great. So knowing where your patients come from would be important.
I'll say for our physician liaison, it's really interesting because here in Central Arkansas, we're pretty well known, established. We're growing in Northwest Arkansas, brand new. So it's kind of two different messages that she's constantly having to change based on who she's talking to, where she is in the state, and, just conveying that message of who we are to those referring physicians, whether they know us because we've been around for a long time in that area or they don't. And we're trying to make that initial introduction.
Okay, great.
Can I add one thing to that?
Of course.
Is what we have really good success is when we have a new physician coming on board. Part of their onboarding process is they get in the car and they ride around with our physician liaison. And a door opens so much quicker when you have with the provider with you. But when we introduced our urogynecologist a couple years ago, through InfoDive, we knew who our referring, OBGYNs and those type, specializing in female health. We got in the car and they went out, she would say, let's block her schedule and things like that. So don't be afraid to ask your providers, and even some of our more established busy providers, once a year, they go riding with Sherry, because they know, like, if they hit a certain county, you can see those the referral numbers are going up. And it's just kind of a nice thing to say, okay, hey, he was out and about with her, she was out and about with her. And so it's amazing the power, just even if you had 3 or 4 hours to go out with them, because we're driving obviously to different counties. But I think that's important too. Don't forget about taking them with you sometimes.
That's great. So switching gears a little bit to kind of like to the digital arena. What about online reviews, Facebook, other endeavors that you've taken that have been successful? Anybody want to speak to that?
Yeah, so we actually, we've been using MedStatics for a long time, and MedStatics is a great tool. It's a questionnaire. It's a fairly long questionnaire, so our response rate is good. It allows us to, the patients to grade the experience, the doctor, would they refer them, has comment section. And, it's interesting about using any of these tools is being able to take that data and use it to your advantage. In our case, we get patient comments, and we have one of our golden standards of Arkansas Urology is practicing radical transparency. And so we send the report cards and the comments out to all of our physician partners. And I'll never forget, I was at a board meeting, we were sharing the numbers, and there was we have 14 partners. No doctor wants to be number 14 on the list of anything. If one is good and 14 is bad, no one wants to be 14. And I'll never forget, after a board meeting, one of the doctors came up to me and asked me, said, can we just not send out these reports to everyone? And I looked at him and just with a straight face said, maybe you should just be nicer to your patients. And strangely enough, his patient satisfaction scores started going up. Now, more recently, we've been looking at our Google reviews, which is what a lot of people use. And we actually went through a process working through a company where our Google rating was, as good as we are, we didn't have a lot of numbers. So one negative review can have a huge impact on your score. And these are real time. So patient walks out the door, it's press 1, 2, 3, 4, or 5 stars, leave a comment. Chris, I can't remember the numbers, but we started off maybe 3-4 months ago, and we were at like a 3.2. And once we've implemented that, and doctors know and providers know it's real time, it's amazing how much nicer they are to the patients and how much more thorough they are. And I think if you go onto Google right now and look at us by site, we're all in the 4.2, 4.5, 4.6 range. So we're trying to decide if we're going to keep both or use one or the other. I'm leaning towards using both right now until we kind of get the numbers where they should be and where we want them to be. But definitely online tools and patient satisfaction scores are effective, both from a rating perspective and using it as a management tool as well.
Excellent. What about you, Marcy?
I was going to let Jason share. I know he can share with our board if he wants to.
Yeah, I can take it, and then Marcy, you can chime in. But so we too were using a company for surveys. I think overall it was working well. I think we were getting feedback. Again, we were very transparent. We sent out the information to our doctors each month. They knew where they scored. But I think the missing piece was Google reviews and health grades and things like that. And we have doctors who, I've got one specifically that was about to retire, and I think he had 7 Google reviews, and he's been practicing forever. And I really think these days, when you do a search, that's what comes up with a star rating. And I think the more ratings, the more people put validity into those ratings and click and read. And I just didn't feel like when we went through and looked at our Google reviews and our ratings that they were truly reflective of, what the reviews we were even getting through the surveys were showing. Because I think most of the time people who went to Google and did those reviews. I mean, you had a few that were good, but I think more times than not, people who are dissatisfied are the ones going and seeking that out and making the comments versus the, passive patients that are happy and satisfied, but just, really don't think to do that. So, so we obviously have recently partnered with Renate, and they are kind of taking care of both the survey component, but also driving those comments and those rankings to Google and Health Grades and different sites like that to build our reputation that way. And I think you're going to show some, some recent success of that. But even in 1 month, I have been absolutely amazed. And I shared this with our board on Monday night. I mean, the spike in our reviews are incredible. And I think, it's now going to truly reflect, kind of an unbiased patient experience. And, and again, I think that's going to help us long term. The other thing we're going to do is actually put those ratings, like Scott said. I mean, there should be a benefit for those doctors that score really well, and maybe a stick for those that don't. So we're actually going to tie those ratings and those comments to our physician profiles. And it's, it's kind of the good and the bad. And again, I think that's going to carry weight for those that maybe have, and all of ours really score well, but I think for those that are lower, I do think it changes behavior and makes them pay a little bit more attention and work on some of those areas where there may be deficiencies so that they can improve those ratings.
Excellent. Excellent. I actually saw my doctor today, and he's been practicing since 1996, and he didn't have any Google reviews. So I posted his first Google review for him today, and I told him, and he was like, "Wow, oh, good, thanks."
So would you give him like 3 stars, Ron?
I gave him 5 stars before he even walked through the door. So I was like, "Hey, this guy needs a good review." But I think the points you're all making are very germane, because it's often the unhappy people that think about going online to leave a review. So that's why sometimes the reviews don't reflect, just like Jason said, they don't reflect the actual quality of the practice or the physicians, because you've got the unhappy people that are leaving the reviews. So,
Can I add one thing to that, though?
Of course. Yeah.
And Jason and I had this discussion, and I always, and he and I said, you have to be prepared when you ask for reviews. I want to put that out there for everybody. You have to be prepared for the good and the bad. You can't be afraid to have that 2-star. I mean, everybody has an off day, but also, this tool, I'm the one combing through the responses every day. And if someone had a bad experience, let's say at one of our outer offices through check-in, I'm sending that review over to our site supervisor to say, hey, do you mind investigating this? And our site supervisors, or even we have site supervisors and we got our clinical supervisors. If someone said, I got a bad lab draw, or she was talking on her phone or whatever, Jason's definitely, bred a culture of, hey guys, let's listen and let's be responsive. And I think that's the big thing. Or I'm, on Google reviews, I'll give Jason's direct line out to say, hey, if we did not live up to your expectations, here's, call Jason Biddy, he's our CEO. And I think that's one thing. Sometimes people are afraid or they don't think about it. So I'm always like, okay, before we ask, let's make sure we're prepared to make those changes.
And Marcy, I'll add to that. I mean, one thing, we don't hide from patients. I mean, if you go to our website and look at our management team, everybody's emails, the direct dial numbers to their desk, it's out there. And if you've got a problem with billing or surgery scheduling or whatever, I mean, you can get my line any day by going to our website. And, we want that because we've got to have feedback. And, I'll tell people all the time, perception's reality to patients. So we've got to listen, we've got to hear what they say, and we've got to adjust, especially if we're hearing consistent messages throughout with, with certain situations.
Well, I applaud that, Jason. That's great, having everybody accessible like that. So we're going to start to transition to questions, because shortly I'm going to turn it over to Evan. Evan's got some great advice for us about managing Google My Business profiles. We already have a question. For those of you who are out there, if you have a question, submit it now, and we're going to start running through some questions. Evan's going to be speaking about some Google My Business profiles, but as we're talking about online reputation, I just want to point out that Reiterate is part of this webinar. We will put together scorecards for your practice to show you how robust your Google My Business listings are. We'll also put together a scorecard to show you what your Google Health Grades, Vitals, and WebMD scores are across those review sites for your providers and locations. So there will be a link in the chat section for you to sign up for that if you want that that service to be provided you for free. We're just doing it as just for the groups that are participating in this, and happy to do that. So we do have one question, so I'll pose this to the panel. So I'm new to the world of urology and in finance. What method have you found most effective in determining which physicians you target for potential referring physicians? So how do you target the physicians that you market to?
So I can say here at Arkansas Urology, we run a report quarterly that we're able to give our physician liaison that tells us the number of referrals we're getting from certain physicians. Those that we're kind of lacking, we make a special effort to go by, and like right now, she's dropping off goldfish and saying, fishing for referrals, please remember Arkansas Urology. Creative little things like that, lifesavers, let us be your lifesaver. At the same time, we see the ones that are giving us tons of referrals over and over again, so we're able to thank them and give them other tokens of our appreciation, like mouse pads or just kind of different little gifts that just say thank you, and we appreciate all you're doing to support us.
Great.
Yeah, and I think what I'd mentioned, we have a report packet monthly from InfoDive, which shows our top referring doctors. And obviously, we're looking at those referrals, seeing if there's changes and calling on those, but also, new practices opening. Again, I think our physician liaison, Marcy, I don't even remember how many years she's been here, but she knows our market. So, we're calling on family practice, urgent cares, OBGYNs, but she'll also hit, orthopedic clinics and, these random specialties, because we do see referrals from them. And then the other thing is if we get a new referral from a doctor, the call center knows to send her a message. So, those have to be set up, and our call center manager typically is the one who does that. So she'll always let Sherry know if there's a new physician added to our practice management system, that's a first-time referrer, and then she'll make a point to go out and touch base with them. One of the other things, and Chris, you mentioned kind of the things y'all drop off. One of the other things that she gives out, two things that they absolutely love. One is clipboards, because again, most of the offices are still giving patients out, past medical, family, social history. Some are still even using paperwork. So we have UCA clipboards with our phone number on it, and she will give those out to any office that will take them. So, a great marketing, and pens, because most of the drug reps are no longer leaving pens and things like that. So again, fairly inexpensive items that, they love getting, and continues to get our name out in those offices.
That's fantastic. Any other questions from the attendees here? Oh, I think we might have another one. How do your patient-facing tools, scheduling, patient portal, et cetera, factor in to patient acquisition? Is the technology a deterrent? And that's open to the panel.
I'll say, I'll kind of kick this off, because we recently, was it 2 years ago, we started kiosks, Jason?
Yeah, that's about right.
So we have the ClearWave kiosk check-in system. And I know we did our research and visited some of the other practices around town, not urology practices, but other specialties that had them. And, because our concern was, can the older population, can they navigate through being able to check in, scan their driver's license, scan their insurance card? And I know a lot of our physicians were worried about that. But then when we would go and visit, we went, like a big orthopedic group here in town had that same system. And they said, you'd be surprised that our senior patients are actually the ones that read through everything. They read all the screens. They're not like me when I just walk up and I'm like, yes, agreed. And they said they actually get less less mistakes that way, because I know when we implemented that, there was a little concern about it. But, we've hired kiosk, liaisons too, and things like that to help people that might be running into problems there. And that triggers, they can have mobile check-in, and so people are able to check in, on their mobile phones before they get into the appointments, and it kind of helps that transaction, like when they first walk in. And Jason,
I think you just have to have flexibility. I think that's the biggest thing. I don't think there's a one size fits all approach. I mean, the technology, the portals, the kiosk, all that's good. But, my granddad who's 93, he's not going to use any of those. And if he walks in our, one of the offices, the idea is that somebody walks out and says, hey, can I have your driver's license and insurance card? And they just do it. And there's no stressor. And again, does that happen 100% of the time? No, but I think that's the intent, is that there are, there are options, and they don't feel like the service is lacking, or they just have to talk to a computer and they can get a live person if needed to assist.
Yeah, I think the reality that we face as urology practices is that average age of a lot of our patients is, in the upper 50s, low 60s. I mean, the average age of a prostate cancer patient is probably closer to 70. And so it's interesting because stepping outside of my office, we have a conference room that has a window overlooking our lobby. And, the doctors keep saying, these are older patients, they don't use technology. But yet, if I look down that window into our lobby, I see tons of people sitting on their phones. Now, maybe they're looking at their email, maybe they're checking text messages, maybe they're on Facebook or some other social media. But the reality is they are using digital technology. I think it's incumbent upon us to educate them. Because the one thing, if anybody's on this call and you're talking about patient-facing issues, to a person, to a group, if I said, what's your biggest challenge in dealing with patients, everyone would see the phone system. Because the path of least resistance for a lot of patients is to pick up the phone and call. And we get inundated with those phone calls. So the ability to use self-check-in kiosks like Jason and Marcy used in there, and we have a kiosk as well. It's used, but not a lot. Patient portals. I mean, our adoption rate is probably 40%, which is terrible. But a lot of patients don't want to log in. They don't want an app. So it's a challenge, but at the same time, I think we've got to recognize that the patients and the technology that we're focused on aren't necessarily the patients right in front of us. It's the patients 5, 10, 15 years down the road. So the delivery of healthcare, I mean, telehealth was a great example of that during COVID, is that people adapt and will adapt if that's what the option is in front of them. So marketing access, marketing better ways to get in touch with us. We actually provide a card that says, and it literally is a picture of a phone, and the tagline is, there are other ways to reach us. And we give them our website, we give them our portal, we give them, using different other access methods to us other than the phone. So great question, and it's a challenge and opportunity as well for a lot of us in urology.
All right, so I'm going to go to one more question. This will be our last question, and I'm just going to ask for a brief answer. As I do want to transition to Evan so he can tell us about the tips for Google My Business. What do you do to actively market to and recruit new providers and ancillary staff? And that's open to the panel.
So I know for us, and we're really kind of creating a whole new philosophy for this, but we're creating just a web page for potential physician recruits. We are kind of just doing some other creative tactics that are special to Arkansas to highlight who we are, the benefits of living here, raising a family here, not being on call, if you're a nurse or an APP versus being at a hospital, but just really trying to highlight the benefits of coming to a specialty group like Arkansas Urology versus our competitors.
Great. Well, great. We could talk about this all day, and it's been an exciting conversation, but we're going to transition to Evan. Evan, we're going to turn it over to you. I think you're going to share your screen. Is that right? You can tell us about Google My Business. Interested in what you have to say.
Correct. Right. Thank you, Ron. I love the whole topic today. It was a really good discussion. All right, so I'm here to provide 8 tips for you. So it's just kind of quick, but just 8 things that maybe you want to take note of to improve your online presence. As you know, or maybe you don't know, if you look at your home page of your website and your physician's bio page, all those bio pages, and then you look at the location listings, location pages of your website, and you add up all the views, they typically come out to a lot less views than patients are actually like looking at the Google listings like this. So it's almost like, the first thing patients see when they search for, let's say, Urology Centers of Alabama is the Google listing. It's like right there on the right side. It has pictures and images. So therefore, we look at it as kind of like your new homepage. It's the first thing the patients see about your practice. So one thing we like to say is just make it look professional. And you could see here, when a patient searches for the practice, it's a very professional look. They were at 4.2 stars and 121 reviews, I think, about 6 weeks ago for this listing. And now they're most of their reviews are 5 stars, so they're building a very nice profile here. So this is a practice search, and it's good for branding. If you invest in your brand, billboards, ads, sponsorships, print ads, in patients search for your practice or potential patients, this is your brand right here, and you want it to look good. There's the doctor search. So we look at Dr. Wade, another doctor at the Alabama group. He's in Birmingham. And, we want a nice picture, really nice profile. Again, more patients will likely see this than the doctor's bio page on the website. So we want this to look good. And then the third type of search are the best searches or the near me searches. So best urologist near Homeland, Alabama. And that's where you get, Google promotes, 3, we call it the 3-pack. They promote 3 listings. In this case, Google's promoting these 3, and we call this local market domination. So this is Urology Centers of Alabama, and these 2 doctors are also with Urology Centers of Alabama. And why are they showing up here? If you don't want to be view all. If you click view all, you'll see all these other doctors and practices. But Alabama Urology Centers of Alabama, actually, they have a domination here. And notice what Google does. They don't do this all the time, but they do it a lot. They have this 4+ rating. So they're showing only reviews or listings that have 4 or more stars. So if you're 3.9 or 3.8, a lot of time you won't even show up, and Google won't even promote your listing on their top 3. They'll be buried in the view all area. So that's a little bit about the practice, the doctor, and then the local search type listings. Those are the 3 types of views and 3 ways that Google promotes your practice. Okay, so let's look at those 8 tips and tricks on how to get seen and discovered by patients on Google. First is to claim your listing. You can't, you want to perfect your listing. You want the photos to look right. You want it to say everything right. You want to put the correct office hours in, have a link to your appointments page on your website. So you can't do any of that without claiming your listing. So the first thing is claiming your listing. A lot of people say, well, claiming listings is like herding cats. And I'm not sure if anybody has tried that here, but sometimes Google will offer phone verification of a listing. And most people say, well, I have a phone tree and, I didn't get my postcards, but if they do a phone call, it goes to a main phone number, and I can't do the phone verification. So one little trick, all Google verifications come from this phone number. 202-455-8888. So if you call your company that does your phone system, your phone tree, and you say, I want you to put a rule in, and most all companies could do this. I want to put a rule in that when I get a call from this number, I want you to route it to my cell phone or route it to my back line in my office. Then you click on the phone verification, the phone rings a few seconds later, you press 1 to verify, and next thing you know, you own the listing. So you might want to try that as a little tip and trick here, is jot that number down. Categories and subcategories. We see listings all the time where it says medical clinic or doctor. In the Google listing itself, they have right here urology clinic. You want to make sure that's correct. And then they have subcategories too, where you could put other types of specialties or subspecialties that you do. And that helps. If you're not categorized as a urologist or a urology clinic, if a patient searches for a urologist near me or best urologist near me, you're just not going to show up in that search result. So just make sure you have your categories and subcategories set. This is a big one, and this is kind of a hot topic. Like, what do you do with your doctors? They go to 2 satellite offices. They see some patients in different offices. Do I create listings for that doctor? Many practices don't. I'd say at least 50% of practices don't do that. We're a proponent of doing that. The con is that it dilutes your reviews, right? If a doctor has 50 reviews, he has to now spread it out among a few listings. But better, you know, if you have a small satellite office in a smaller town, and a patient in that town searches for a urologist near me, you have a very high chance of coming up if the doctor has a listing that's in that locale, in that satellite office locale. If you don't have a listing, then the doctor's never going to show up. So from an SEO standpoint, or Google promoting your doctors and your practice, it's really good to have those personal listings for the doctors at those satellite offices. So you could dominate that local search, you know, where you have your practice and the doctors come up in that local search instead of your competitors. The fourth one is just common sense. But Google and their algorithms, they write articles about this. One of the strongest factors in them promoting your listings is the number of the average rating, you know, 4, 5, 4.5, 5 stars, the number of reviews, and the recency. Google likes fresh listings. So if the last review posted on your listing was 180 days ago, 6 months ago, Google's not going to promote that as much as a listing that has fresh reviews all the time. So Scott and Marcy, you mentioned you have a software that handles that. Jason too, you have software that handles that. That drives recency, and you want to drive it for your doctors and your office locations, not just your locations or your doctors. You want to spread it out and get fresh listings throughout your whole practice. Your doctors in their satellite offices, their listings, and the practice listings. So we have just 4 more. You want to respond to reviews in a HIPAA-compliant manner. But responding to reviews, that's another Google algorithm thing, right? If you're interacting with patients, you know, Google likes that. They like to see that interaction. Any business that's interacting with customers or patients, Google's going to give you preference in there and promote your listings more than your competitors if you respond to those reviews. And Marcy, it was good to hear that you guys, you know, are proponents of that and are actually actively responding to your reviews. NAP, I know it's getting late in the afternoon. This has nothing to do with sleeping a little bit. This has to do with name, address, and phone number. Believe it or not, when you have a listing, Google really doesn't know exactly that it's tied to your practice. There is a website link, but it's not. You want Google talks about this all the time, the NAP. They want to have you match exactly the name, address, and the phone number on your listing with the location. Let's say it's for your main office location, with the location page on your website. So much so that you want to do, if you're in Suite 101, you want to make sure if it says STE 101 on your Google listing, you want to make sure it says STE 101 on your website location page. You don't want to say #, you know, #101 or Suite 101. You know, you want to match it exactly. Same thing with street names like Boulevard. If it's spelled out that way in your Google listing, you want to spell it out on your website, and names too. So everything you want to make sure is exact. Same like with the doctors. If a doctor is John Smith III, you want John Smith III on your Google listing. If it's you know, C. Charles Boone, you don't want a different variation of that name on the Google listing. You want to match everything perfectly, and that creates better links between your Google listings and your website, which helps you come up in those search results and helps Google promote your listings more vigorously. Each listing at the bottom has a bio, kind of like a short bio description section. You could put keywords in there, talk about the procedures that the doctors, that each doctor does. And those keywords are also good for Google. They take inventory of those keywords, and it helps when patients do searches for like vasectomy doctor near me. It's good to have those keywords. So Google gives you 750 characters for a short bio or description on the Google listings, and it's good to just complete those for each listing. And the last tip is photos. Let's just go back here. You want to have a picture of a building. We've seen pictures of dumpsters, right? You want to make sure it's a professional picture. For the doctors, you want to make sure it's a professional headshot. In fact, Google suggests their best practice that you load a high res, like a high res headshot picture, rather than just one picture who's like taken on an iPhone or a low resolution picture. So you want that high quality picture for a really good look. And you'll see, we've seen things like one orthopedic practice of ours, the patient uploaded a picture of a hand that was operated on, and it had like all sorts of pus and stitches. You don't want patients to see that, especially in the urology specialty. You don't want those kind of pictures. So you got to monitor the pictures, and if you see a picture you don't like or is inappropriate, you could appeal it, and Google will remove that picture. So those are the 8 tips to maximize, Google, you coming up in local search more, and Google promoting your practice and your doctors. Just to wrap up, those scorecards, this is what they look like. We made up some names here, but we look at Google, Healthgrades Vitals, WebMD, and we'll show you anything that's over or under 4 stars. We'll color it for you, and the quantity too. Anything that's under 30, we'll highlight that for you. And same thing with the Google listings. We have an engine that looks at all your Google listings and looks at all the elements. Remember, I talked about, does it have a short bio description? Does it have a website link? Is the listing owned? Does it have office hours appointment link? Does it have a category that's correct? Like oncologist or urologist is correct. Doctor is a red flag. That's not a real category that you want. And we'll do the quality, the quantity, and the recency as well. Again, very common to have like a main office have reviews recently, one day ago, but sometimes you'll see, 10 months ago will be the last review posted. So we'll show that too. So we're happy to prepare these scorecards. It's in the Zoom chat, and if you'd like us to review it with you over a 10-minute period, we're happy to do that. Any questions about Google that anybody wants to ask? Feel free to type them in.
Evan, I noticed the names were made up on those scorecards, and one of them was Coleman Slosky. So Cole Slosky. I think that's
a good one.
Very creative. A shout out to Lucas on that one. That's got to be Lucas.
I used to own an EHR company, so we'd have. I'm not going to tell you the urology name of the patient, but we'd have like Michael Skinner would be our dermatology. Rebecca Bourne, Bourne would be our OBGYN doctor. So we had all these interesting names for the patients that related to the specialty.
So Evan, there's no questions coming through that I can see. I think this is I want to just thank the panelists. Great information. I do encourage you to take advantage of the courtesy scorecards from Raider 8. And reach out to us if you have any questions. And Scott, Chris, Marcy, Jason, thank you so much for your participation. And I want to wish everybody a great day. Thank you.
Thanks, guys.
Thank you.
Thanks for your time.
Appreciate the opportunity.
Take care.
Thank you. Take care.